Providing effective ventilation is critical to successful high-quality CPR, especially in respiratory-related emergencies such as drowning, anaphylaxis, and asthma. Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because using a bag mask device is such an important skill and is common in the healthcare setting, we'll work on it now. Bag mask devices consist of a ventilation bag and a face mask, and they come in a variety of sizes. You can also use supplemental oxygen with a bag mask device.
To begin, position yourself directly above the person's head. You'll use the EC clamp technique to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow end of the mask onto the bridge of the person's nose. Then lower the mask fully onto the face, watching for the cushion to bulge as it initially seals against the face. Form a C with the thumb and index finger of one hand and press down on the dome of the mask toward the face to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back, lift the jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, you're not providing adequate breaths. If you don't get chest rise, readjust the mask, reposition the head and neck, and try again to ventilate. And then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, the most effective way to deliver breaths with the bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face. And the 3 remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the 1 rescuer bag mask technique so that in a few minutes, we can combine it with compressions to work on a 2 rescuer sequence. We'll pause here to get into position.